Well, if nothing changes, some people may die, and that's the warning from mental health professionals throughout the state tonight in the wake of the latest 7 Action News investigation.
At issue, millions in state mental health funds that were slashed by state lawmakers.
It's left scores of mentally ill children and adults in the lurch.
But a senator who helped push those steep cuts through didn't want to defend them. To 7 investigator Ross Jones.
Senator, can we ask you a quick question during the elevator ride by chance?
Senator Roger Kahn was one of the early supporters of Healthy Michigan, a bipartisan program that expanded Medicaid coverage to nearly 500,000 people, saving the state millions. But today, Senator Kahn doesn't want to talk about that. Perhaps that's because the move towards Healthy Michigan led to major cuts elsewhere, slashing state funding for mental health services in half. State officials expected federal dollars would cover the difference, but so far, for some, they haven't.
This is an example of unintended consequences. You think you're doing a good thing and you think you're planning properly.
Scores of mental health providers like Karen Schrock say the cuts went too deep. So deep, in fact, that organizations like Adult Wellbeing, where she's CEO, had to cut back or eliminate vital programs. For 30 years, her nonprofit helped provide guardians for the developmentally disabled, elderly, and abused who can't take care of themselves.
We're going to make sure they have a good home. We're going to make sure they get their health care, that they get to the doctor, that they have food in the refrigerator. Without this kind of oversight and support, people will die.
But that wasn't enough to sway lawmakers like Senator Kahn, quoted recently in the Detroit News saying, "I'm not very sympathetic. I think they've got enough money. They've been hanging out of my office with their tale of woe. The government is supposed to be a hand up, not a handout."
This isn't a handout for people. This is something that is needed. It's something that's not going away.
Christy Ossenmacher says her family is another example of Healthy Michigan's unintended consequences. Qualifying for the program is based on income. An individual can't make more than $16,000 a year, and a family of 4 can't earn more than $33,000. Christy makes more than that, but she's not looking for help with her medical expenses. She needs help for her son. 15-year-old Denny is severely autistic, unable to understand other people, communicate his feelings, and develop relationships. For 10 years, the state paid for Denny to get help here at the Guidance Center, providing services that private insurance won't cover. Things like speech therapy, someone to help Denny in school, and a case manager to handle his therapy and medications. But with the mammoth cuts to state mental health funding, those services are gone, and Christy says she can't afford them.
He needs a psychologist. He needs speech therapy. He needs things I can't give him at home, and it scares me.
These are individuals with great needs, and they're somebody's family member.
Tom Watkins heads the Detroit-Wayne County Mental Health Authority, which helps provide services for the county's 74,000 mentally ill. This year, the state funding to his program was cut by nearly $20 million.
The legislature is going home, or is about ready to go home, and didn't see this as a priority.
Senator Kahn is one of those legislators beginning summer recess tonight. The Saginaw Republican heads the Senate Appropriations Committee that approved the cuts mental health providers warn could prove catastrophic. For more than a week, we tried to speak with him, sending emails and making phone calls that he never returned. When we showed up to his office on Tuesday, his staff said he didn't have time to see us. So when we found him on the Senate floor earlier this week, he ducked out a back door just to avoid facing our questions.
A number of the state's mentally ill have lost services, sir, that they were receiving before. Sir, can we talk to you, sir? This is a serious issue.
That's when Kahn sought a Senate security guard to have us removed.
I'm being harassed by this gentleman.
Can we talk to you outside, sir?
Kahn slipped out again, this time using a back door to seek shelter in his office. And now he and other senators are preparing for summer recess tonight with no plans to address why thousands of mentally ill are without services they used to receive.
I hope that some, when they go home, will touch base with the mental health agency in their community and really find out what's going on with the people in their community. Unfortunately, they'll probably have their mind elsewhere.
Officials with the Department of Community Health need to update lawmakers by November 30th with how Healthy Michigan is working, or in some cases not working. Some are hopeful that that means those who lost services might finally get the help they need, but it's a long time between now and the winter, especially for kids like Denny. I'm Ross Jones, 7 Action News.